This is Nadisha in Chicago, and you're watching my channel, Knowledge for Quality of Life. Friends, over the last year and a half, I've been trying to cover various topics related to one's health status and how we can maintain and check and do certain stuff on a regular basis to enjoy the better quality of life in the long run. Today, I'm going to be talking about all those vlogs in the form of a summary, and I'm trying to put a closure for the time being to the health topics, and hopefully from next week I'm going to be starting something new. But by no means I'm saying that I'm done with the health topics. We have just started, and there's a lot to learn, and I'm learning myself as well as we speak. So before I do that, I welcome all those who have recently joined the channel uh, and the community of learners. And I hope that over time you can learn and grow with me, and we will keep this relationship going. Uh, as I said in the past, that by no means through this channel I'm trying to prescribe anything or recommend anything. This is like a footprint which I'm leaving with you guys and the future generations, so that they have something to fall upon. Because when I started 9 years ago, I had nothing. And I did a lot of learning and a lot of iterations and a lot of things I've done. And all I'm doing, sharing with you here. If you come across any issue or any topic which you may be interested in, uh, please put in the comment section and I will try to address it in a timely manner. I have seen that some comments are coming, which I've been addressing directly to those individuals. That they are looking for certain recommendation, like for instance, that how much vitamin K2 I should be taking, what form I should be taking. But as I said in the beginning, that this is not my job to recommend you anything. My job is to give you the awareness, as I have gotten myself the awareness over time, and I want to pass it on to you. So that's why my vlogs are geared towards or centered towards the main elements which drives that issue. So you have the bigger picture and understanding. And when you work with your doctor, you can have a better conversation with your doctor, because some folks may say that healthcare is something that we should leave it to the doctor. Of course, by not any means we are trying to be our own doctor, but at the same time, 25, 30 years ago, the knowledge was monopolized in every area of the field, whether it's finance or education or healthcare. With the information and technology age, now a lot of information which was before hidden to certain individuals, now it's at our fingertips. And all we are trying to do that educate ourselves, because learning never stops. Learning is the key thing if you want to grow yourself over time. And that's all we are doing. We are sharing the information, what the science says actual, and what you hear in reality. Because the way you are going to do things for yourself, no doctor, no financial experts, can replace that kind of attitude which you are going to be doing on your own. Now, I'm not saying that you should be doing everything on your own without consulting anyone. No, I'm not saying that. But I'm saying that you do your due diligence and you do your homework very well prepared. So when you have a conversation with an individual, whether it be in the health field or finance or education or anything else, you can have a better questions in perspective to ask and have a dialogue with that individual, so that you are not completely clean slate, that a person can write whatever they want. A better informed and educated consumer is a better informed consumer as well. So you know in this society, the way things are, that everybody wants to take you on a free ride. So all I'm saying that I'm sharing the best practices, and take it from there. And this is like creating a baseline for yourself. and learning is the way to go going forward. So let me come to the point that I'm going to go one by one, and uh, so that you understand that why I did certain things in a way I did it over the last year and a half years time. First, I started with my own story of vitamin D. And I started with 27, and I when I did the vlog, over time, I increased up to 122%. It's a huge jump. And because, I've been given directives by the doctor that, my previous doctor who I, fired, basically, I went with the new doctor for the last 6 to 7 years. And he was giving me a final clean answer at the end of the day, by doing certain things that you can't do anything because you are wired genetically that way and to have a low vitamin D. But I proved that thing completely wrong. And last April, means last month, when I had my complete blood work, yearly annual checkup, my new vitamin D level is at 64. Now, if I divide 64 by 27, that's 137% jump. So, it's still creeping up, it's going up, and the other things are markers are changing. So I don't have any words to put in, and I have done quite many vlogs on vitamin D, and I have just scratched the surface. There's so much on vitamin D that I can speak about, but I don't want to bore you people, by talking about vitamin D. But I can tell you one thing in a nutshell that watch my vlogs on vitamin D, and certain individuals can have issues with absorbing the D. I have covered vlog that what are the protocols one should be taking vitamin D. So make sure that you understand that thing. And beyond that, there are certain individuals who are probably which are not absorbing, and who are probably have a particular genetic variant. And then you have to see your endo doctor, endocrinologist, and maybe he can work with you and refer to the genetic specialist who can check that variant, that variant can stop you from absorbing. So there's slew of things can go, but normally for 85-90% of the people, if you follow the regular protocol the way I have explained in the vlogs, you should be able to absorb the vitamin D. And vitamin D is something that I spoke about, that it's a huge thing. In a one sentence, if I were to explain you that if we don't inhale oxygen for 5 minutes or so, we may die. But if we deprive ourselves from vitamin D, in the long run, our quality of life is going to be miserable, because we will be surrounded by numerous diseases which can be mitigated through optimum level of vitamin D. So if you have any questions about particular vitamin D, please put on the comment section, and I'll try to address it if need be. The second factor, which goes with the vitamin D, I spoke about the cofactors, which is vitamin K2. I have covered few vlogs on vitamin K2, the form you should be taking, dosage I've been taking, because there's no dosage established yet as RDI, or RDA. And you have to go by your ApoE genotype, which I have covered many vlogs, on ApoE genotype. That ApoE2 supposed to clear vitamin K2 very slowly, so they feel like backup in the system, and they have a palpitation issues and a lot of other things. Now, MK7 being a longer half-life of 72 hours, which remains in the system for 3 days, and if they take daily basis, they can have an issue if they carry ApoE genotype 2. But on the contrary, if they have a ApoE genotype 4, one copy of 4, they are going to clear very fast, so they will not have enough to reach at the cellular level. So they may need to increase their dose. But ApoE2 do normally well with MK4 version, because MK4 has a shorter half-life of 4 hours. It can clear the system fast because they have a slow clearance rate. So please watch those vlogs for the better understanding, because no doctor is talking about ApoE business, ApoE gene as far as vitamin 2 clearance is concerned. So this is my personal observation with my wife, which I have explained in vlog in detail. The third area I talked about metabolic syndrome. It's a silent issue, a silent state of the condition of our body that takes us slowly to insulin resistance. And once that insulin resistance goes a little bit beyond, we can be a diabetic. So make sure that your homeostatic model and assessment, HOMA-IR, which I explained along with the metabolic syndrome vlog, you are clear on that. And understand that thing, how it works, because nobody is checking fasting insulin, and fasting insulin could be a very detrimental thing, taking you to hyperinsulinemia, and it's frequent eating is the cause, because every time we eat, we invite the insulin to rescue us, and too much insulin in our body is not good, floating all around the time. So if you have an issue of the insulin control, or insulin resistance, intermittent fasting is the way to go. Start with little, skip a meal, go 12-12, 12-hour fasting and 12-hour window, and then stretch it from there. Go 18 and then 6-hour window, 18-hour of fasting. You can drink water, and make sure that you are not depleting yourself from the basic electrolytes. So what I do, sometimes I have in my water a pinch of pink salt, because it has about 82 to 84 nutrients in there, which can replenish my nutrients in the body, like potassium, sodium, all the electrolytes which a body needs to tone the muscles. Then we talked about hsCRP. This is a silent killer which stays inside the inflammation, which is not seen by us. If our arteries are inflamed, it creates numerous fire hazard inside. And hsCRP, that's a high sensitive C-reactive protein. It's a marker of inflammation which needs to be monitored on a yearly basis. If something is going on, inside your body, this hsCRP. So nature is very smart. Nature has kept checks and balances in our system, and hsCRP is going to flare up, and that's going to give you indication to you and your doctor. If your doctor is very attentive to the test results which you receive, sometimes they overlook because they have so many patients. It's you at the end of the day that needs to be in charge and owner of your own results. So if you see something is there and doctor didn't bring it out to your attention, make sure that you bring it out to doctor's attention, that what's going on here. So that needs to be monitored. Then we talked about heart disease conditions. We talked about cholesterol and all that, right? So standard lipid panel is out of the date, completely outdated. LDL, total cholesterol, triglyceride, and those parameters which doctor normally checks, it's not of any use in assessment in the bigger picture of the heart disease. So you should be doing either NMR or cardio advanced level cardio IQ, which gives you entire lipid panel distribution. That what kind of a small dense particle which are atherogenic in nature, and how much you have, and how you can. And I've shared my case study that I have completely reduced those by 72% by alternative lifestyle, because alternative lifestyle is so powerful that it's not realized by a lot of people. And of course the dedication is required, the commitment is required. So it's our choice, it's our priority that we want to pick a pill over the lifestyle. But there are certain conditions, sometimes the lifestyle is not going to change anything, and then eventually you have to take a pill. But at least you have a chance of making this attempt of first lifestyle modification if you choose to. Then if it doesn't work, then of course pill is always the last resort. So make sure that you do the lipid panel distribution, the particle distribution, which I'm talking about. Then we talked about blood pressure, how blood pressure plays a role. High blood pressure plays a role, and what are the main ingredients. And again, if you look at all these things I'm talking about, D is the common denominator. It touches everything. So RD status, vitamin D status, is it's the bread and butter, and it's the foundation laystone of our entire existence. Otherwise, nature has not given us a potential to produce our own D in the presence of sunlight. The system has been placed in our system that we can produce our own vitamin D by reacting 7-hydroxy, which is the cholesterol, in the presence of UVB sunlight. This is such an important thing that nature has wired us accordingly. So remember that this is not something very subtle or very unnoticeable, because if nature does something, it's got to be something big. It's not we cannot underestimate by any means. Then I talked about sleep, that what is the optimum sleep, and sleep is a major factor in overall health. How it has a J curve, and we talked about it in separate vlog. Then I talked about ApoE genotype, which I mentioned earlier, that it's very important thing to know. It's once in a lifetime test. It's not a big deal. Whatever you have, you have. You have to learn now how to mitigate that. Because you cannot change that genotype, whatever you have inherited, whatever we have inherited from mom and dad. So this is what we got, then we got, but what are the things which we can do to mitigate the adverse effect of this genotype which we have? So there's a myth out there that, my mom or dad had some diseases, whether it be heart disease or, diabetes or any other issues, so I'm going to get it. No, that's not true, always, because genetic factor plays a role, but to some extent. But, I've shared in many vlogs that, the lifestyle modification that, particularly in D and all those lifestyle modification which we've been talking about, they can play a role up to 80 to 90% if the genetic plays a role of 10%. So ultimately, we control majority of the risk factors. But on the contrary, if we are compromised on the lifestyle modification risk factors, and we have a genetic variant as well, so it's like a double whammy, then of course we are bound to get it. Because, I spoke about it in the past one vlog, that gene modulator is vitamin D. Vitamin D modulates our gene. There are certain genes should remain off, and there are certain genes should remain on. And it can have that switch on and off phenomena, and that's what vitamin D does. Because that's why we say that it's a gene modulator, it's an immune system modulator as well. Then we talked about non-alcoholic fatty liver disease, NAFLD. So, you get your CMP, complete metabolic panel, and CBC. Keep an eye on those parameters, because, these two things is being checked by every doctor, mostly in an annual blood work. But sometimes, these ALT and AST is missed by doctor. So you have to see that, these are liver enzymes, ALT and AST. That's going to give you a first clue that something is not working right with your liver. And then doctor can, take a deeper dive into looking certain other things that, what's going on. So make sure that you keep an eye on your ALT and AST liver enzymes. Then we talked about, rise in death amongst youth. People are, having a cardiac heart arrest and all those phenomena. So checkups and, monitoring. How do we know that, we don't carry a particular genetic variant or, or genetic predisposition? Particularly people who have family history of certain diseases, they have to be very careful also. Then we talked about autoimmune disorders, and autoimmune disorders is directly proportional, a strong correlation with vitamin D status, besides many other things. But, and the requirement for vitamin D for autoimmune protection is quite high, and I have done separate vlogs on that for autoimmune issue, particularly when I shared a case study of a doctor for multiple sclerosis. So autoimmune gives you a better protection for vitamin D level from 80 to 100, and some doctors raise their eyebrows that, oh, that's high level, that's toxic. No, I just got recently, my last month, my vitamin D status is 97.3, and my calcium level is 9.4. It's staying the same. It's not going up. It comes around 9.2 or 9.4 because I'm taking decent amount of K2 with it, along with I eat natto as well. So I'm getting enough vitamin K2 in my system, which guides my excess vitamin D from the blood calcium, blood serum level to the right places, and it's not suspended in the blood serum. Then we talked about homocysteine, how homocysteine plays a role, including in heart disease or including in dementia and Alzheimer's as well. So that's a good marker to keep an eye on a yearly basis. Then we talked about Alzheimer's and dementia, that it's a disease, but, with the lifestyle and, those parameters which I shared in the last vlog last week, we can mitigate 80% of the time. The risk factor, we control it, and there are certain things which we don't control, so we don't control, like environment. So we have to be mindful of that. We cannot blame everything on our fate, that, this is what it is, that, because that's the difference between us humans and animals. We have been given an intellect. We have to use it in a proper context, that, how we play, in certain aspects of life using that intellect. Then I talked about 𝗟𝗏, extra virgin olive oil. That's a very powerful therapeutic, diet supplement that one can use in the right context, provided you get a proper extra virgin olive oil with the right source and mono variety, and you can trust on that olive oil. So I have done that separate vlog on that. Then we talked about my wife's case study of osteopenia as well, and how vitamin D, K2, protein, vitamin C, plays a role in increasing the bone density, along with the strength training and impact exercises, certain impact exercises, which gives you a bone to generate the bone growth, and how it plays a role. Then I talked about glaucoma, which is a silent killer, which can create a tunnel vision over time without any signs. So make sure that you get it checked from a regular specialist, ophthalmologist, and they are the specialist people of checking the eye pressure and field vision and all that, health of the optic nerve, how it is. Particularly if it runs in the family, you should be checking on a yearly basis. Then we talked about thyroid health, how thyroid plays a role in overall well-being, so how D plays a role in maintenance of thyroid, including one's iodine status, and selenium also, because these three elements plays a vital role in the thyroid management. Then we talked about prostate, and I showed the case study of a gentleman who cured his prostate with the vitamin D supplement. And vitamin D, actually, there are certain types of cancers. I came across a recent study that, there are certain types of cancers which has a very, strong correlation with one's vitamin D status and Ki-67. Ki-67 is a proliferation growth factor. It tells you it's a protein in the cell that it dictates that how fast the tumor cells are going to multiply. So in a nutshell, in the bottom line, that higher the D status, lower the Ki value is going to be, Ki-67 value is going to be. So they are inversely related. So if somebody's vitamin D is high, the Ki-67 factor is going to be lower. Lower means somebody, if God forbid somebody gets a cancer tumor, it's going to be a favorable tumor to treat with. It's curable. So it's not going to be aggressive. So, it's a win-win situation. So that's why I've been emphasizing. I started this series of vlogs from vitamin D, and there was a rationale behind it, because over the last 8-9 years, whatever I've been touching upon, related to health, D is coming again and again in various multiplying forms. That this is the backbone of. So that's why I said in one of my vlog that D is it's a vitamin. It's actually a hormone which requires from cradle to grave. So please remember that. Then I talked about vitamin K2 clearance rate, how it's related to ApoE genotype. Then lifestyle modification, which I have done, and I have benefited myself, within my family, other members, including my mom and my wife. Various blood tests I spoke about, and I've done a separate vlog on that various blood test which I monitor, about 30 to 35 tests which I monitor the health status on a yearly basis. So in a nutshell, what I'm saying here, that take these vlogs as a footprint, as a basis, and you can enhance, you can modify, you can build on it. If you are a further researcher or some read some sort of a very vivid reader, you can build on it. But there is no monopoly on knowledge anymore. If somebody is saying that I cannot do it, this is what individuals' choices are. You are thinking that you cannot do it. It's not that you can't do it. You chose not to do it. But yes, reading, knowing, learning, lifestyle modification, it requires dedication. It requires discipline. Nothing comes free. There is no free lunch. We have heard this thing over and over. So the amount of effort one is going to put, the result, the output is going to come accordingly. And this is the message I'm going to leave you with. And I hope to see you next time, next week, and I will be starting something new, hopefully. And until then, see you.